Kitambi. He is a full-time researcher and assistant professor in the Department of Microbiology, Tumor and Cell Biology at Karolinska Institute, Sweden, which is a Nobel Prize awarding institute. He has worked at Harvard University and was nominated at MIT. He has published few papers in the peer-reviewed journal like Cell. He has transferred tumor-treating drugs to multinational pharmaceutical companies. He is presently engaging in studies on gene regulations in chronic ulcers due to leprosy in LAP patients. We welcome you, sir.
Okay, thank you CLRI, Ramakrishna Mata and King's Institute for this invitation. I'm Satish Kitambi from Karolinska Institute in Sweden, and one of our lab's vertical is to work on leprosy research. We look at wound healing, we also look at cost-effective early detection technology and novel in vivo culture models. So I don't have to introduce leprosy here. We all know that it is a socioeconomic medical burden, and focus should be put on early detection so that preventive cure would be one of the best way to achieve global eradication. And patient rehabilitation is also one of our focus, to see the cured patient are brought back into society. So first, looking at wound healing, this was done in collaboration with Dr. Gunasekaran and his team at King's Institute, especially Siva Subramaniam. So here what we have done is we have utilized the high collagen content from amnion, and you have seen some of these slides presented by Dr. Gunasekaran. And we have harnessed the healing properties and antimicrobial properties of a seaweed called carrageenan and developed sheets. So we have developed sheets, and CLRI, King's Institute and Ramakrishna Math, they had organized a clinical trial. We have used this material for making a wound conditioning, and then this has achieved remarkable effect on healing of these wounds. When I say wound conditioning, what I mean is the material acts as a sponge. It sucks out all the exudate, it removes all the dead and debris material, and it also removes all the microbial material because it already has an antimicrobial property from seaweed sources. And this allows the body to heal itself. So this is one of the more natural and best possible way to heal the wound. So we have also looked into the mechanism of how this is being achieved, and what we see is just by promoting the body to achieve healing by itself, it acts via a signaling mechanism that is very similar to EGF-based, growth factor-based therapies. And we also see that the material can stimulate very good collagen secretion, especially the collagen that resides on the skin, that can achieve good quality healing. And what we are going to do now is we are developing shoes that are based on 3D printing, which actually mimics every patient's foot size and foot dimensions, so that this allows a proper integration of these patients into the community. We have some sample footwear down below, and if you are interested, you can take a look at it. So we'll be very soon organizing clinical trials with this footwear, and this was developed by Robo Balaji Uday and his team. So coming to early detection system, I think this is one of the problems that was highlighted by previous speakers. We have PCR-based, histology-based techniques, but what would be the best way to detect is actually sequence the bacterial signatures that are, if you have the bacteria and it is residing on you, you will be able to sequence it. And this is what we are doing. We are developing strips called lepra strips, where we are using biomaterial coated on the strips. This biomaterial will be used to trap the bacteria, which will stay there and will enrich them. And once we enrich them, each bacteria or each strip will be barcoded by nucleotides. So this is a new technology we have developed for cancer, but we are adapting it to leprosy now. So all these strips can be then pooled together into one sequencing sample. So that means this can be achieved for as little as 1,000 rupees, one sequencing sample, and you can for sure detect the presence of the bacteria or not. So that means this technology can be applied mass. You can do a mass survey with this, since it is barcoded, you can pool all of them and then you detect which area is having this presence of the bacteria. So this is something that I want to adapt. The problem is I don't have access to the patients, and I don't have access to the bacterial cultures, and that is why I'm extending this as a collaboration with King's Institute and CLRA and Ramakrishna Math, and also the Leprosy Center for Leprosy Research in Chengalpet. So some of these technologies can be very well translated as a social setup or a startup company. So I'll be very interested if somebody wants to take the initiative and offer this as a service for a survey. So please contact me or talk to me. The next is in vivo model. So the problem with leprosy is it's very difficult to culture. What we have done is we have utilized a small model organism called zebrafish. So zebrafish is very interesting because it is very tiny. It's a few hundred microns in size. It develops outside the body, and it is transparent in its early development with the animal pole at the top, vegetable pole at the bottom. So the fish develops from the top. And it is transparent, so you actually can see through a simple microscope. So what we are doing here is we are doing lots of transplantation. Either you can transplant cancer cells and see how it migrates into the fish, or you can actually transplant bacteria or viruses and see what it does to the developing fish. What we are doing here is we are putting in, this is Mycobacterium tuberculosis, labeled in red. You can actually transplant it into zebrafish, and then you can see it migrates, you can map how it migrates. So we want to achieve the same thing in with Mycobacterium leprae, and that is why this is also that can be translated from my lab to any research institute or company that is interested in working with this model. So many things can be done. One is to understand how Mycobacterium leprae affects and causes the deformity. So this can be done with this model. Another thing is you can use this model for performing large-scale drug screens. That's something that was pointed by the chair in the previous session. This is a cause of concern with drug resistance. We need to find new drugs, new molecules that can, with which we can combat this disease. So we have also standardized the assay setup for this, and we can easily make an in vivo model. So this is an entire organism. So if something can affect this organism, can also have an effect on us. So we can actually find molecules that can very specifically kill the bacteria without harming the growth of the fish. So this is also done in my lab now, and I'm very open for collaboration. With this, I think I should thank Dr. Gunasekaran and especially Siva Subramanian, who has been spearheading lots of work with the wound healing, and his team, Tangam, Suresh, and Satuma. Rest of the technology has been developed in my lab primarily by Gayatri and Sarah, and these are the funding agencies that have supported us till now. With that, I would like to end my session. I hope it was under 10 minutes. Thank you.
Thank you, Dr. Madan and Dr. Satish. Well, I think whatever the technology you have talked about,